Hi guys, this is Dr. Bidmos with Public Health Talks. On today's show, I'll be talking about sickle cell disease, and I have Dr. Jejelola Owotomo that will be helping me to facilitate the discussion. So now a brief introduction of Dr. Owotomo. She is a sister, a friend, a wife, a mother of 3 beautiful children, and I am proud to call her a colleague. Dr. Owotomo is a epidemiologist with a focus on sickle cell disease. She has been working in research for over 7 years and hope to make a difference in different communities. So welcome to the show. I'm excited to have you here today.
Thank you for having me. I'm excited also to be here today.
Thank you. So now, as someone who battles sickle cell disease yourself, so would you please educate me and my viewers on what sickle cell disease is all about?
I will say this in layman language as much as possible because it's a little bit complicated and it's not everybody's well educated about sickle cell disease. It's a disease of the red blood cells. So it affects, a severe case of it will affect organs. So it damages organs and several other damages to human body. But sickle cell disease is a disease that causes pain and shortens red blood cells in the body. Most people with sickle cell disease don't have enough red blood cell. If a normal human being should have like 10 to 15 units of blood in their body between female and male, a sickle cell person will have about between 5 and 7. If you have 7, you're very lucky. So it's deadly if it's not monitored and you don't know yourself and you don't take care of yourself and you don't know the right thing to do. But you can live through sickle cell disease if you know yourself and you can take care of the situation and people around you are educated, especially with little kids. The parents are well educated, the community is well educated, and people live through this. I know people are 80 years old with the sickle cell disease, and it comes with a lot of pain. And people with the low, let me say, in a better way again, in a very understandable manner, people with sickle cell disease mostly have crisis, and it's not everybody that will have crisis, and most people have crisis. So it depends on your age factor, and which means what causes crisis in sickle cell disease patient. So that's the little I can say about sickle cell disease right now.
Yeah, you said that, crisis. I've still gone through your crisis before. And I have to say it was pretty scary, because I learned about it, like reading books about it, but I haven't actually I think you're the only person in my life that I've come in close contact with, in terms of, person that I know has the disease and how they manage it. So now you're a wife and mother of 3. So you mentioned one of the ways is to be able to manage and have, good support system. So how would you tell people or me how you manage it as being, because parents, with little kids, we know how, difficult it can be, especially, battling, sickle cell disease. So how do you get everything under control?
Okay. It's quite difficult to get things under control. When I was little, I used to think I was normal by getting sick all the time. Like everybody who doesn't get sick is not normal, because it was a norm for me. I have to be sick like every week. I have to have crisis at least every 2 weeks, and I was always at the hospital. And my mom, I don't know how she got through this. I think she was just educating herself every time. And I didn't know what was going on. So I don't care about resting. I don't care about stressing. I don't care about anything, because I was little. I didn't know what was wrong with me. Why am I like this? When they tell me stop dancing, you're dancing too much, I'm like, why can't I dance? I have to dance. Everybody's dancing. So I didn't know what it was. And after dancing, I'll have crisis. It's a lot of battle, and it messes up the quality of life of individual with sickle cell disease. However, if you have good support system, you have parents and family and community who are well educated about the disease, your lifespan is more likely to be longer than every other person with sickle cell disease with lifespan of 21 years old. I'm well over 21 now, running towards being 40, and I pray to be well old enough to live through this. However, it's very difficult to take care of somebody with sickle cell disease because you don't know what they're going through. You can only hear what they're going through. You can only see what they're going through, but you don't exactly know what it is. So what I can say that you can use, or I mean, people are struggling with the sickle cell disease and people, their family members struggling with them, is that to understand how they feel, you can never know it. They say they're going through pain. You will never know the pain that they're going through. It's only the person that has it that knows the pain. I mean, imagine hammering the wall with a huge hammer, and then you mistakenly hit your finger with a hammer while you're hammering the wall. If the pain is times 100 of that. So, and if I tell you I'm having pain, you might not understand unless you see me struggling. And one thing I can say to manage this, to care for someone with sickle cell disease, is to understand what the disease is exactly.
So you said something about when you're going to your crisis. So can you educate me and the viewers what a crisis is, so we can grasp the full meaning, or at least partial understanding of what a crisis is?
Oh goodness. Oh, okay. Let's look at it this way. Someone with sickle cell disease, I always say it this way, the best way, that I think is that you can't cry too much and you can't laugh too much. You have to be in the middle. You can't sleep too much. You can't not do without sleeping. Some people be like, oh, I slept 10 hours, 20 hours. Oh my gosh, I feel good. A sickle cell person can sleep 20 hours and be sick from that sickness because they've been lying down in one place. And the blood flow through the bone marrow is stuck. So you cannot run because you're stressing it. It will get stuck. And you cannot do without moving. It will get stuck. So you have to be in the middle. You can have infection like a normal human being. You have to be, if you have infection, you have to fight it really quick because it can affect the bone marrow again, the blood flowing again through the veins and everything again, and it's going to get stuck. You can't be in too cold and too hot. My family know that they're used to it now. My husband used to be very, very, very upset about that the house is very, very warm. And to me, that is normal because if you make it too cold, I get sick. If you make it too hot, I get sick. So now he's used to it. So we have to meet in the middle. And so when you have the crisis, let's say I was in the cold. If somewhere is too cold, I start having a crisis, or I stress myself, or I'm emotionally stressed. Any kind of stress will trigger this. And which means that the blood vessels are constricted. And now the blood is flowing. We don't have normal cells like every other person. A normal cell is very, very nice, soft, flexible, and everything that can go through the veins and everything very, very nicely and soft. It flows through. But with people with sickle cell disease, it's sickle and it's very rigid and it doesn't have the cushion. So if it's constricted, it gets stuck. And you have to take something to release that. It's either you put a heat pad on it to release it, and the heat mustn't be too much because when it's rushing again, it can get stuck. So when it gets stuck, that is when the crisis occurs. It can happen. Every joint of my body can start hurting, like my arms, my legs, my everything in my body will start hurting. And I've had blood clots before because it's just too much drama that comes with sickle cell disease. But the best thing you can do with someone who has sickle cell disease is not to treat them like they have to, like don't pamper them. Don't make them feel like, oh, you're always gonna be sick. So don't make them feel like they are not good enough for something. Don't make them feel like, oh, I don't want you to jump. Oh my God. But, support them. They want to jump, support them and make them feel like, oh, maybe you should jump from this place to this place instead of you jumping from that place, here. So you have to make them feel comfortable also. And don't say, oh my gosh, it's raining outside. Don't go on the, you have to make them support whatever they want to do, but make them understand that you can limit it and still feel good about it. So
what would be like, couple of things, two things that you can share that can trigger, a crisis, for example?
For me, because like I said, everybody's different. People have sickle cell disease and they have different categories. We have sickle cell SS, SC, and the last one, I can't really remember the name as of now, but it's something about beta thalassemia. I can't really call it. I don't want to say the wrong thing. However, the one I really focus on is the sickle cell SS. That is the one I focus on and I research on. So the one with the SC, they don't get sick as much as SS. And people with SS, depending on their age factor, like I said, some of them will have crisis, some of them don't. Some of them just get tired all the time. Okay, when you say you're tired, that is the way we are on a normal day. When you say, oh my gosh, I'm tired, I'm 24/7 tired. So when I say I'm tired, I am done for. So I mean, for me, what triggers my own crisis is like when I'm stressed out, emotional, any kind of stress, working too much, sitting down too much, like anything that can trigger my stress. And if I'm in too much cold, I will have that. Or I go running. I envy everybody. People who go to run and go to the gym and like, oh my gosh, I'm losing weight, I'm doing this, I'm staying fit. For sickle cell person, you can't really say I want to go running. You're going to come up with a crisis. So you have to choose one. Do you want to be in the hospital or you want to just stay healthy and stay alive and manage yourself? So the most I can do is to take a walk. Okay. So what takes another person one day to achieve, for a sickle cell person, it can take 100 days because it's baby step all the way. So those are the things that trigger my own crisis.
Okay. So what are some of the myths about sickle cell disease that you would like to dispel?
They have a death sentence already. It's not a death sentence. Like I said, if you manage this, everybody's gonna die one day. So if you're someone that doesn't have good lungs and you're smoking, you're going to die. So it's not a death sentence if you know how to take care of yourself. And they can have children. Don't say, oh, you're getting married and she's sickle cell, or it's sickle cell. Oh my God, you're gonna carry something that you cannot handle. Blah blah blah. It's not. It's not death sentence.
Yeah. Well, I mean, you're a living proof. You're married with 3 kids, and So, but I mean, I guess that would be like cultural stuff. Driving all those myths. I mean, I guess, but I'm not completely sure. So like are those some of the things that we heard in terms of your culture?
Yes. Culturally, it's not about death. This is about someone who's even educated. They'll tell you that, it may be a death sentence. But if I tell you about culturally, it's a whole lot more. And maybe she's Obanje, or she's a witch or something, or, different kind of things. Or maybe they cursed her, or they cursed the family with her, or they waste money. They're people, maybe they curse the family so that they would never be rich. Because, of course, if you have a sickle cell patient, a daughter or son, you're always going to be at the hospital and you'll be spending money. But if we are all educated and know that you carry the trait and I carry the trait, if you actually if you love that child a lot that you're going to have that you've not even had yet, you shouldn't put a child through sickle cell. Okay. People say, oh, there's love, we'll do this, we'll do that. When we're pregnant, we'll go check and make sure that when you're pregnant and you're already 12 weeks pregnant or even 2 weeks pregnant, you don't want to take that baby out. So why are you going to go through the stress of, oh, I'm going to check, if I check and it's sickle cell, we're going to take it out and then we're going to have another one again? It's not fair. A child never asked to come to this world. You brought them to this world. So before you make a decision about getting married to someone with the traits, think about the future of that child. I mean, I don't regret ever coming to this world because my parents weren't educated enough to know that they shouldn't do it. At the same time, I'm glad I'm here with sickle cell disease so that I can teach other people. Honestly, don't do it, because 30 something years, I'm still going through my stress of living with sickle cell disease, you know.
Yeah, so as you know, that people with underlying conditions are the most at risk of complications from COVID-19, the elephant in the room. So what has been the main concern for you in terms of your health during this pandemic?
Okay, talking about me, when I heard about the COVID-19, as an epidemiologist, I know what it is anyway. I know the outcome of this. I know what can cure this already. I know everything that's going to happen in regards to this. But as a sickle cell person, someone with sickle cell, I thought to myself, I take a pneumonia vaccine every 5 years. And this is because I don't have like strong lungs like that. I always have pneumonia because of the sickle cell disease. I have heart murmur because of the sickle cell disease. I don't even have spleen anymore. My liver enzymes are always off the roof, depending on what is going on in my life at that moment. And if I'm pregnant, it's even worse. But I realized that, okay, I need to be alive for my children. So every 5 years, I take this pneumonia vaccine because it affects the lower respiratory organs, right? So what I did was I had to go get my pneumonia shot because it was due in February, and I was postponing it and until March when it became a pandemic, and I had to run to my doctor to go get the pneumonia vaccine. So if you think that you have to be 60 something years old to get a pneumonia vaccine, that's false. You can get it if you have sickle cell disease or immunocompromised. You have to talk to your doctor about it and get a pneumonia vaccine. This is not going to prevent you from having COVID-19, but it's going to reduce the effect of it on your lungs. Okay. I've had pneumonia before, and it's I know what it is when they show them on TV about being intubated and everything like that. It's not like I've had it only once. I've had it like 3, 4, 5, 6 times in my life. And I know what it feels like to have pneumonia. You won't be able to breathe. It's like a sharp knife in your lungs, and it's crazy. I was pregnant and I had it also. So I would not escape it if I didn't get the pneumonia vaccine. So with the pneumonia vaccine, it's going to help it, but it's not going to prevent me from having it if I'm infected. But it's going to reduce the risk of being intubated or anything crazy. I mean, I'm not saying that it's prevention, but at least it helps.
That works for you.
Mm-hmm.
Yeah. So that's in addition to your, washing hands and.
Yeah. Because okay, it's a whole lot. I'm dealing with this like I do. Even with my husband, I look at everybody like they all have COVID-19. So if we go outside, we wash our hands. I mean, the kids are playing outside when they come in, so we have to wash our hands, take off our shoes outside. The house has to be pure from it. We wash our hands 20 seconds. I had to educate my children about it. My children have the traits of sickle cell disease, but they don't have the sickle cell disease. So we wash our hands. We make sure everywhere in the house is clean. When we get groceries, I have to wipe every single one of my groceries down before we even put it in the fridge, because the virus actually lives longer in the fridge because they're cozy in the fridge. So I would say that wipe everything down, treat everybody like they have COVID-19.
Yeah.
Make sure even when we get our mail, we'll have to wipe the mail down before we even open it. Or we'll put it somewhere for 3 days before we open it. So you have to be really cautious. As sickle cell disease someone with sickle cell disease, you have to be really cautious because you are more prone. You already have a pre-existing disease, so you are more prone to have to get more sick or really, really sick from this disease. So we have to be really careful.
Okay, so now I guess this is my final question. From a personal and professional standpoint, what would you advise people who are parents of those who battle sickle cell disease?
Oh, I'll advise them to just pray. Honestly, I mean, even if you don't believe in prayers, just have that faith that you have these children and they're going to be there forever. I mean, not forever, but they're going to grow older and grow old and not die young. I just tell everybody with sickle cell kids that they should not stress more than necessary. I know there's always stigma out there, but if you know what sickle cell disease is, it's easier. So I'll tell them to do more research, be well educated, and educate their children also. As they're growing and they know right from wrong, you have to keep teaching them about what they're battling with. That's what I can say.
So basically, because I mean, like you said, this is something scary. So especially someone with the first child, has sickle cell disease, and they have no idea. I mean, having a child on its own is like it doesn't come with a manual. You don't know what you're doing half of the time. So I mean, imagine someone with their first child with sickle cell disease. So you can't even imagine the stress and so they need people like you that going through it to sort of like, give them the advice, or
Yes.
to calm situation down.
Yeah, actually, I'm not the first child, and actually, I'm the second child, and the first child has sickle cell disease also, who died from sickle cell disease. So my parents were so paranoid, and they believe that me coming to United States will better our situation, because back then we didn't have enough equipment or enough treatment for someone with sickle cell disease. And to be honest, when I came to United States, they didn't know what sickle cell disease was either. So when I got to the hospital, they asked me, "What do you want me to do for you? Because I don't know what you're battling with." And I tell them I need something for me. And they know that the only thing we can give you is IV and oxygen. What else can we do for you? And I tell them what to do. But now they are more educated, even in the United States. They have a lot of doctors for sickle cell disease now. And there are a lot of research out there for sickle cell disease. So now they do better now with caring for people with sickle cell disease. They know what to do. But back then when I came in 2002, they would ask me, "What do you want us to do?" So, I mean, I pray and I hope that people who are fighting this will fight a good fight and understand what the disease is and educate the community also.
Okay. Well, that concludes our discussion today. So I want to thank you so much for joining me, Dr. Owotomo.
Thank you for having me.
Show. And I really hope to bring you back some other time so we can get in depth on this subject matter, because I've gotten a lot of requests on this topic, on my Instagram page. So hopefully we get to bring you back another time to get more in-depth talk about it.
I would love to come back too. Thank you so
much. Yeah. That was Dr. Jejelola Owotomo educating us on sickle cell disease. And like I told her, I hope to bring her back other times to talk more about this disease. So if you have any public health issues or topic that you want me to shed a light on, or you would like to appear on the show, feel free to send me a DM, and continue to practice the preventive measures in place. Until then, until the next video, keep safe and stay positive. Thank you, guys.